Welcome to 12 to Your Health. I'm Dr. Derek DeSilva. This week we're talking about neuropathy. It's a nerve condition that can impair sensation, movement, and gland or organ function. Joining us today is Amit Gaglani. He's the owner of Arrow Physical Therapy in Edison. He's here to talk about an innovative new procedure that promises to help people suffering from this debilitating disease. Thank you so much for joining us once again, Amit.
Thank you for having me.
So let's start with neuropathy. What is it?
Sure. Neuropathy, peripheral neuropathy, essentially is nerve damage. We commonly see diabetic neuropathy in our office for patients who have symptoms of stabbing pain in their feet, sharpness, pain in their feet, numbness or tingling, or total absence of sensation.
Mm-hmm. Is it more common in particular disease state groups than others?
Yes, commonly seen in diabetics. Yeah, we commonly do see it. What happens is the increase in blood sugar is harmful to the nerves. It essentially causes the nerve to degenerate, and that degeneration causes all those other symptoms.
A degeneration or a poisoning, if you will,
Absolutely.
of the nervous system
Yes.
is basically what the sugar does, right?
Absolutely.
So tell me about this new innovative program that you've put together to treat this.
Well, we've been actually doing it successfully for the last 4 years. We've treated hundreds of patients with it. It uses a machine that causes a muscle pump. The muscle pump essentially is created via large emitter pads that are put on the lower extremities, and it causes a nice rhythmic contraction. It's very comfortable, causes a rhythmic contraction, which causes fresh oxygenated blood to flow down to the periphery. Mm-hmm. So that fresh oxygenated blood helps to regenerate that degenerated nerve. And therefore, these patients are starting to feel better and starting to get less symptoms. Now,
So it comes down to blood flow to improve the symptoms. That's
part of it. Essentially, yes. And then on top of that, we have certain manual therapy techniques as well as specific exercises that we have created and put together that accentuates the whole program, and patients benefit greatly from that.
And what kind of a success rate are you seeing with this?
Oh, very high success rate, in the 90s. If the diagnosis of peripheral neuropathy, of diabetic peripheral neuropathy, is on target, then we get a high success rate with these patients. These patients also come to us, they can't walk sometimes because they can't feel their feet, they have very poor balance. So overall, by the time they're done with us, they're able to walk, they have better balance, and they're able to feel less pain, and they're able to feel their feet where they weren't able to before.
How long does it take to start?
It takes about 4 weeks. You can actually see results within a 2-week period of time.
Mm-hmm. All right, so it's painless, which is very good.
It's non-invasive.
All kinds of other modalities involved with this, and great results.
Yeah.
Well, thank you so much for joining us. Keep up the good work that you're doing over at Arrow.
Thank you for having me.
Here's a look at what's coming up